Interesting.
Yeah.
We are back on MorningLine. Thanks for joining us. Our final segment with our guest, Dr. Cosby Stone. He's from over at Vanderbilt, an expert in allergies. In fact, he's going to the clinic right after this, or to ICU, right?
That's
Where
right.
you're involved with a study there on
That's
that.
right.
And you know, people allergic. It's scary when you think about people allergic to antibiotics when
Yes.
they need treatment for maybe something that's killing them, that's a bacterial infection. But
And that's what we focus on.
well, if I was allergic to penicillin and I'm dying of a bacterial infection, I'm going to say, let's take a risk with the penicillin. Just give it to me.
Yeah. So there
What's
are
the reaction
people,
from that?
No, so there are people, right? So we used to think that penicillin allergies were forever. But it turns out that between 95 to 99% of people will grow out of a penicillin allergy.
Okay.
You know, and whether it's you weren't actually allergic to begin with or you were allergic, the people who were allergic, we know that even if you have a positive skin test, that 10% of people will lose that allergy every year. By the time 10 years has gone by, the likelihood that you're still allergic to penicillin is really low. There are certain penicillin allergies that people don't grow out of. They're the really severe ones where your skin basically falls off and you get really awful blisters.
Oh, okay.
But the ones that are more like anaphylaxis or hives, or or you felt short of breath, or you had stomach upset, people grow out of those. So the problem is exactly what you've described. If you need penicillin for your treatment because you've got the wrong infection and you can't take it, it turns out that can increase your chance of dying. It can increase your chance of having your treatments fail. It can increase your chance of having a surgical infection. It can increase your chance of getting the drug-resistant infections that everybody's really worried about. Because when we have to give you the less effective antibiotics, the second and third line antibiotics, they don't always work as well as plain old penicillin, especially for certain infections. And so what we're doing now at Vanderbilt is that we are really focusing on this as a problem for our hospitalized patients and the patients who have frequent contact with the healthcare system. The people who are limited in their choice of antibiotics to maybe only one or two things, and those one or two things aren't always the best thing for what you need to have your treatment for. So if I find you in the ICU at Vanderbilt and you have a penicillin allergy, I'm going to talk to you about it, and I'm going to figure out whether or not you are one of those people who has such a low chance of still being allergic that we can just give you a dose directly without a skin test.
So you'll just do and you'll figure that out by
talking to people.
Talking to them?
Because if you tell me that your story is my mom told me I was allergic, or I had a rash when I was a kid, or it made me have stomach upset, or something like, I don't know, I avoid it because my cousin was allergic, then I know that you have a almost 0.00000.
So you wouldn't give many little tests just to see if it's okay?
No, we skip straight to a dose because we know that you're among the people who are not going to react. So if you come to clinic, we're going to skin test you because it makes people feel better. But if you're in the hospital and you need it right now, we're going to skip straight to a dose and we're going to watch you carefully.
And if somehow, some way you do have a reaction, then you deal with that.
You're in the hospital already. We're going to take care of you.
That's the way to do it. Let's go to Janet. Janet, good morning. Hi, Janet.
Hi, Janet.
Hey, thanks for taking my question.
Sure.
I was wondering, is there any allergy medicines that are non-drying? I have dry eyes, and my eye doctor said I need to go off my allergy meds, but it's not. I'm doing the Flonase only, but it's not working for me. I'm getting sinus infections.
Yeah. So for you, probably the best option would be to try some of the antihistamine nasal sprays.
Flonase is not that?
So
it's a steroid?
Flonase is a steroid nasal spray. You're right, Nick. But the antihistamine nasal sprays, they tend to do the trick without drying out everything else around you. If you take it by mouth, it's going to work in your whole body. If you take it locally, you can control the symptoms without giving yourself as many of the side effects.
Sense.
Yeah, so
she was saying by taking the pills, she was having trouble with dry eyes and everything. So the doctor said, well, why don't you just try Flonase? And that's not working alone.
Yeah, so you were probably taking the antihistamines by mouth, one of the over-the-counter antihistamines. There are prescription nasal spray antihistamines that you can talk to an allergy doctor about or your regular doctor about, and those might work without drying out your eyes. They might still dry out your eyes a little bit because the nose is so close to the eyes that sometimes we can't always predict that. But what I would do is I would focus on the things that you can do topically in your nose that can improve your symptoms. And so Nick is a big believer in the neti pot, I know, and I'm a big believer. A big believer in saline washes. If you're not already doing that, but washing your nose with saline, either with one of those squirt bottles or a neti pot, can rinse all the pollen out of your nose and reduce your symptoms.
When you do that, you don't have to do it so you feel it running down your throat, do you?
No. You got to lean forward.
I know.
Lean forward over the sink.
Because I hate that. It runs down your throat, and then I get a sore throat. I don't want to do that. I just want it to be just circulating here, and then you spit it out, or it runs out your nose, right?
No, the technique for this is, I see you right there.
Okay.
So the technique for this is that you have to stand up, lean forward over the sink, and rinse your nose either with the neti pot like this or with a squirt bottle, leaning forward the entire time, because you can rinse out your nose without it going down your throat.
Is it going up into your sinuses when you do that?
Yeah, okay, especially if you squirt it hard enough. But don't squirt it so hard that it hurts.
I know, it is so weird when you do it.
Gentle rinse.
Neti pots are weird. You get it going, and all of a sudden it goes in one way and it's coming out the other. And you're like, if I pour it in my ear, will it come out this ear? No, I mean, but you know what I mean? It takes some getting used to.
Yeah.
But your idea of neti pots, you want to use pure water for that?
Yeah, you want to use pure clean water, and you add the salt packets.
Meaning buying distilled, or would you take it from the faucet?
So you can either boil the water yourself at home, and then store it in a jug, like an empty jug where you know that it's clean, or you can buy yourself a jug of clean, cheap distilled water.
Okay.
And save that for your rinses.
And just because there have been some reports sometimes if you have impurities in the water, it can create infections up there. Otherwise, along those lines,
you got to make sure your water is sterile before you don't want to squirt lake water in your nose.
Right, exactly, things like that. All right, so maybe do that. So you're saying topically, but then possibly asking your doctor about a spray antihistamine.
Yeah, so I would talk to your doctor about the alternatives to the oral medicines, the drying medicines, and see what can be figured out. There are options. There should be.
I always do like to bring this up with you and any allergist that comes on near the end of the show. Last thing, when we talk about spray stuff, again, neosynephrine and some of those other sprays, which, by the way,
they work
are on the market and they work. But again, now that's neither a steroid or an antihistamine. What are those? They're constrictors?
Those are blood vessel constrictors.
So you're swollen in your nose, you can't breathe. You hit that with one of those, whether you have a cold or allergies.
Yeah.
All of a sudden, within a matter of seconds, it's like someone took a pipe cleaner to your nose.
Yeah.
You can breathe.
Right. And I would reserve those for two things. Reserve them for a cold, and you can't sleep. You can use it for 3 days.
Maximum 3 days, meaning, and follow the dosage instructions exactly.
Yeah, exactly, because it will help you breathe until you get over your cold. And it will help you breathe at nighttime. You'll sleep better.
I'm afraid to even go 3 days.
Everybody feels better. I know.
I'm afraid to even. I mean, I will use it one day maybe just to cut myself some slack, and that's not going to shake my cold. But tell them why I'm afraid of that.
Yeah, the reason you're afraid is because if you use it for too long, then your nose gets kind of hooked on it, and then you have worse swelling than you did before. Yep. So that's the things like the Afrin. I don't want to call people out by name, but the pseudoephedrine, the neosynephrine.
All of them work. I mean, I've used Afrin and I've used neosynephrine. They work, and they're good products. You just have to follow the guidelines with them.
Right. And the second reason why you would use it is if you are a person who goes up and down in an airplane and you get miserable, you can use it before you get on the airplane. Or if you're somebody who is I want to try you want to try scuba diving, but you're the person who's sensitive on an airplane, you're probably also going to be sensitive under the water, so you're going to use it before you go scuba diving. Pressure changes. Yeah. You can use it to alleviate the pressure symptoms in your nose from pressure changes.
Well, and if you don't, and I think a lot of people don't realize it, they get it and they're like, well, this is a wonder drug, it's fantastic, and they keep doing. And I've told the story of a friend of mine who was on it for weeks on end, and he basically became addicted to it. Not addicted like, oh, I need my methamphetamine, and I don't mean that. I mean addicted where his nose couldn't function properly without a shot of that.
That's right.
And let me tell you, coming off of that was a bear, because for several weeks while his nose readjusted without it, he couldn't breathe through it. He literally couldn't breathe through his nose for a few weeks because the tissue was so swollen, hungry for more of that chemical. Is that kind of what happened? And then eventually it comes back down. But he was on it for so long, he became addicted to it.
Yeah, and some people are so stuck on it that we have to, kind of treat them through it with steroids.
Yeah, it's no fun not being able to breathe through your nose. And so it's worse later than what it was you were treating yourself for in the first place.
That's exactly right. So those medications are useful for two things.
And they work. They're good. They're good.
But you only want to use them for 3 days or less.
Yeah, 3 days or less is the ticket on that. All right, so I guess as we wrap things up, we've taken a few calls on that. Anything else that we should just hit on this morning? Maybe that you've seen in the clinic, or what's going on right now that you just want to have a closing note on? Yeah,
so the last thing to avoid in the summertime, to be careful about, is tick bites. And we're all becoming a little bit more aware of the fact that ticks carry diseases, but they can also induce this red meat allergy called alpha-gal allergy.
Yep, I've seen some stories on that.
Yeah, so be very careful when you're out in the woods. Make sure that you wear your tick protectant. Make sure you do a tick check. Find your tick check buddy. Somebody who'll check you to make sure that you don't have one hiding somewhere.
How
because
long after you're bitten would you typically show a symptom?
Yeah, so usually the people who say that they got the allergy from the tick bite, they noticed a really large inflammation, in the area of the tick bite. That's a pretty common story that they give us. The people who get an infection from a tick bite, like if you start feeling awful within 12 to 24 hours of a tick bite, then tell your doctor immediately.
Yeah, and it can be any number of illnesses that are associated with it. I don't know, and I've had my share of ticks already this year. I had one under my arm. They always find a moist, warm spot.
They do.
And I try to check myself, and I wear tight pants and everything out there, but I had one right under here. And I'll tell you, after you pluck it off, and this one, usually I find them before they bite me, but he got me there, and it was probably I slept with it. And the next day, I plucked it off with the tweezers, and it's fine, no infection or anything.
Yeah.
But that sucker itches for the next 3 weeks. It's like, geez.
Yeah, and you can put some topical steroids over the counter stuff on it.
Geez, I got there and one on my hip. But is there any advantage to having, in this instance, I was able to pluck it and I had it in my tweezers.
Yeah.
Is there any reason I should save that tick? Like maybe what I mean by put it in a little empty pill bottle with some alcohol, seal it, put it away. Thus, if I get an infection, I could give you, my doctor, my tick, say, this is a sucker that bit me.
Yeah.
Is there any testing or anything to be learned from that dead tick?
Sometimes, but really, I'll have to talk to my friends at the Tennessee Department of Public Health to figure out if they actually can use them very often.
If they were. The odds are, you just say, I got bit by a tick, we'll diagnose you. You can't learn something from seeing the actual tick itself.
Remembering a tick bite's much more memorable because you pulled it off. Remembering a spider bite, you don't always remember a spider bite. You're like, I don't know, maybe it was a spider bite because you didn't see it. So usually you can remember that it was a tick bite.
Yeah, have you ever had a tick?
Oh yeah.
Yeah. I mean, people freak out. Look, if you're going to work in your garden, if you're going to be in the woods, the odds are you're going to get one.
Right.
Check yourself. Most of the time, I catch them while they're walking before they catch hold.
Yeah, and for people who live in the areas where they know they have friends that have gotten sick from tick-borne diseases, the thing that you want to remember is that you can pre-treat your outdoor clothes with a permethrin camping spray. You can spray them down, you hang them up on the line, you let them air out overnight, and then that's good for 5 washings, and it should repel and kill a lot of the ticks that try to get on you when you're out and about. But the other thing is just don't go crawling around in the places where the deer are going to be hiding, because that's where the ticks are going to be waiting for you.
Well, and the deer everywhere. I one time, as an experiment on my own, I had a pair of white jeans.
Yeah.
See, I treated my skin and everything. I had white jeans, and I put on a shirt like this.
Yes.
And I went walking through the brush in our backyard. Just walking around for 10 minutes, and I walked back out, and I had, because on the white, they stood, none of them bit me, but they were all over. And I'm like, wow, look at all these ticks.
Oh, and they jumped on you because they could see you coming a mile away.
Heck yeah, and they're right there waving on the end of a branch, and they just jump on you. So watch out. That's good advice, ticks. Sir, thank you. It is always a pleasure having you on.
It's always wonderful to be here.
You're terrific, and I hope at least we educated some folks on this
and thank you to your callers, and thank you to your audience for wanting to know about this.
Keep up doing the good work at Vandy.
You bet.
Thanks again. We'll see you again soon. I'm sure we will.
Oh, yeah.
We'll take a break. I will be back with the programming note about tomorrow right after this. Stay with us.